Hello, dear listener. You are right on time for the Morning Bazaar show where we talk about everything and anything that you need to know about your body. My name is Ashley Kendi Marcelina and welcome to Legit FM 106.5. So for today, we want to delve into the topic of sexual and reproductive health. And good sexual and reproductive health is basically a state of complete physical, mental, and social well-being in all matters relating to the reproductive system. It implies that people are able to have satisfying and a safe sex life, the capability to reproduce, and the freedom to decide if, when, and how often to do so. So basically, for the maintenance of one's sexual and reproductive health, people need access to accurate information and the safe, effective, affordable, and acceptable contraception method of their choice. They must be informed and empowered to protect themselves from sexually transmitted infections. And when they decide to have children, women must have access to services that can help them have a fit pregnancy, safe delivery, and healthy baby. Every individual has the right to make their own choices about their sexual and reproductive health. Adolescent fertility in Kenya is vital in the development and execution of reproductive health policies and programs. One of the specific objectives of the Kenyan Adolescent Sexual Reproductive Health ASRH policy developed in 2015 is to decrease early and unintended pregnancies in an attempt to reduce adolescent fertility. Empowering adolescents to achieve sexual and reproductive health and rights, including preventing unintended pregnancies, is critical to their overall health and well-being. Yet, data shows that sexual and reproductive health services in Kenya fall short of meeting adolescent needs. For example, an estimated 665,000 young women aged between 15 to 19 in Kenya are married or sexually active and want to avoid becoming pregnant in the next 2 years. More than half of this group, that is 3,575,000 adolescents, have an unmet need for modern contraception because they either use no contraceptive method or use traditional methods. Each year, almost 2/3 of the estimated 345,000 pregnancies among adolescent women aged 15 to 19 in Kenya is unintended. The vast majority, which is 86% of those unintended pregnancies, occur among adolescents who have an unmet need for modern contraception. The new data also indicates that many of the 217,000 adolescent women who give birth each year in Kenya do not receive the essential components of maternal and newborn healthcare recommendation by the World Health Organization and Kenya Ministry of Health. About half of these adolescents have fewer than 4 antenatal care visits, and 1/3 do not give birth in a health facility. So, full provision of modern contraception combined with adequate care for all pregnant adolescents and their newborns in Kenya would provide young women's health and well-being by resulting in 160,000 fewer unintended pregnancies per year. That is at 73% decline from current levels. 2, we have 81,000 fewer unplanned births per year at a 73% decline. 57,000 fewer abortions per year, that's also a 73% decline, and 340 fewer adolescent maternal deaths per year, which results to a 76% decline. A multifaceted and coordinated approach should be put in place to fully meet adolescent needs and ensure their rights to make voluntary and informed choices regarding contraception. To improve young people's sexuality and reproductive health and rights effectively, services must be non-discriminatory, medically accurate, and age appropriate. Approaches that should be included are improving access to and provision of comprehensive sexuality education and youth-friendly sexual and reproductive health services, in addition to community and school-based programs that seek to destigmatize adolescent sexual activity and access to reproductive health services. Well, we may have or may not have heard of the term STIs or STDs, which may mean sexually transmitted infections or sexually transmitted diseases. And these are caused by bacteria or viruses or parasites that are transmitted through unprotected sex, that is, vaginal, anal, or oral, and skin-to-skin genital contact. Bacterial infections include bacterial vaginosis, chlamydia, gonorrhea, and syphilis. Viruses cause genital herpes, hepatitis B, human papillomavirus, which is called HPV, and human immunodeficiency virus, which is basically HIV. Let's talk about symptoms. Well, in many cases, sexually transmitted infections can be transmitted unknowingly because a person can be asymptomatic, which basically means that he or she does not exhibit symptoms. Depending on the infection, symptoms can appear within days or weeks, and this for infections such as chlamydia, gonorrhea, or genital herpes. It can appear weeks or months, that is for diseases such as hepatitis B, HIV, syphilis, or it can take time and appear after exposure to the microorganism. Common symptoms which may appear alone or in combination include abnormal genital discharge, burning sensation when urinating, bleeding after intercourse or between periods, rashes and sores in the genital or anal areas, swollen lymph glands in the groin, and sudden fever or appearance of flu-like symptoms. One should note that sudden or eventual disappearance of symptoms does not mean that you are cured from the infection, since it can return or manifest itself in different symptoms. Many sexually transmitted infections can be treated with antibiotics, although gonorrhea is becoming increasingly resistant to antibiotics or antiviral. If left untreated, infections can lead to infertility, pelvic inflammatory disease, cancer, chronic liver conditions, pregnancy complications, and birth defects. So let's head on to matters prevention. How can we avoid from getting these diseases? And one way is by actually practicing safe sex, which means using a condom correctly and consistently. To abstain from intercourse is another way, and also if engaging in oral sex, one should ensure that he or she uses a male condom or a dental dam. To ensure that you pack male or female condoms, because you never know what will happen when you actually go to that place. Also ensure that birth control methods such as oral contraceptives, injections, IUDs, or diaphragms do not prevent STI transmission, and condoms are not fully effective from infections acquired through skin-to-skin contact like genital herpes. Also, avoid behavior that increases the risk of contracting an STI, such as casual sex with a stranger or a sex worker. We need to actually ensure that we are responsible drinkers, because drinking heavily or taking mind-altering drugs will actually impair judgment and inhibitions during a sexual encounter, increasing the risk of making unsafe choices like not using a condom. Also, ensure that you avoid getting tattoos, body piercings or acupuncture treatments, which, when you actually think about it, things like sharing of razor blades or toothbrushes or needles can actually get you or make you get an infection. Also, ensure that if you have engaged in risky sexual activities or suspect that you may have an STI, visit a healthcare provider immediately. If the results confirm that you have an STI, inform all your sex partners and encourage them to seek testing and medical attention. Education and counseling can improve people's ability to recognize the symptoms of STIs and increase the likelihood that they will seek care and encourage a sexual partner to do so. Well, unfortunately, lack of public awareness, lack of training among health workers, and long-standing widespread stigma around STIs remain barriers to great and more effective use of interventions. For instance, we have a hospital known as Casino whereby people go for treatments, STI treatments, but people actually feel stigmatized to even go and seek for that healthcare. We see that people seeking screening and treatment for STIs face numerous problems. This include limited resources, stigmatization, poor quality of services, and often out-of-pocket expenses. Marginalized populations with the highest rate of STIs, such as sex workers, men who have sex with men, people who inject drugs, prison inmates, mobile populations, and adolescents often do not have access to adequate and friendly health services. In many settings, STI services in low and middle income countries are often neglected and underfunded. These problems lead to difficulties in providing screening for asymptomatic infections, insufficient number of trained personnel, limited laboratory capacity, and inadequate supplies of appropriate medicines. Well, that's all that we had for you at the Morning Bazaar. My name is Ashley Kendi Marcelina, and always remember to keep safe and take care of your body. Keep it legit, FM 106.5, and I wish you a lovely day ahead.